Hi, Dr. English. Thank you for being with me today. I really appreciate it.
Thanks, Dr. Boring-Bray. I'm happy to be talking with you today.
Great. I know that one of your passions is moms-to-be and new moms. This is a hot topic right now because many moms, they're scared, they don't know what to do or what to think. Can you walk us kind of through what your thoughts are and how can we be supportive as a community for them? Maybe what they could ask their providers,
Sure.
any other resources that you have in order to calm anxiety, calm fears. What do you have to offer those moms right now?
Well, first of all, just to kind of talk a little bit about what the challenges are facing pregnant and postpartum moms and families right now. When we decide to have a baby or when we find out that we are pregnant, we have a vision in our minds for the people that we're going to have in our lives during our pregnancy, what that's going to look like, whether it's a gender reveal party or sharing those ultrasounds in a card hand in hand to your parents and then having them open it, and it's the hugs and all of those pieces of the announcement, excitement and celebrations. And then we also have very specific images and visions in our mind for who we want to be present when we give birth. And I happen to work at a freestanding birth center here in Phoenix, Arizona. And many women like to bring a doula in addition to their partner. And so sometimes it looks like a triad in addition to the midwives and the birth assistants. Sometimes it might be a doula and their mother and their partner or a sister. And so, really their birth team is up to the pregnant person to choose. And so it can be very difficult when the pregnant person finds out that they don't get to choose more than one person or that they may have to give birth alone. So as you can imagine, that is a massive, it just hits you really hard. It hits hard to all of the moments that we have maybe been imagining for all of our lives, some of us. And it definitely creates a lot of additional fear and anxiety about how will I get through this without those people. Some people have a wonderful relationship with their partner. Some people don't have a partner at all. And so, without a birth partner, what would that look like? Or if I can only bring one birth support person, what would that look like? So there are a lot of questions around that right now. And we're seeing a lot of variability in terms of hospital policy. If people are giving birth at a hospital, sometimes they're not allowed to bring anyone. Sometimes they're only allowed to bring one partner. And some of them are allowing more than one person. I was just reading something earlier today about the University of Washington's hospital system is allowing to support people. So that's definitely more than being told that you can't have any, which was what New York State had done for a while and, is also happening in other areas. So there's a lot of fear going on about that. There's also a lot of worry about, should I even go to a hospital? If my plan was to give birth in a hospital, is it even safe for me to go there? Do I run the risk of contracting an illness? Does my newborn baby or does my partner? And then there's also the fear of if all of the resources are going, in hospitals are being directed to those who are infected with coronavirus and are suffering from COVID-19, then, is that going to take away from the support that I might receive from hospital staff? So there are a lot of fears right now, and it's being handled very differently. One of the unfortunate realities of the American system is that we don't have a unified approach. State by state is very different. It depends on who owns and who runs the hospital, what their kind of culture is. And I've heard, just here in town between the different hospital systems, there's a huge variability in the way that pregnant people and birthing people are being received and supported. And so there have been some really great experiences. We had a mom who gave birth and needed to transfer, and then her child ended up needing to be in the NICU, which was, very safe, wonderful birth at the birth center, but but what happened afterwards was baby did not respond well, started to lose, breathing, and, they weren't even COVID positive or coronavirus positive, but they still needed to be transferred to the hospital. So even if everything goes well with your birth at home or in a birth center outside a hospital, you might still have to be transferred and have care and have to stay or manage, care for or being present for an infant in NICU.
Mm-hmm.
And only one parent can be there at a time right now. And so that too is just a real big fear, and it's causing, a lot of questions for pregnant people. Obviously, there are a lot of support resources that we like to encourage people who are pregnant to reach out to. Birth educators and doulas and midwives are wonderful at providing additional supports, usually through websites, but many of them right now have Instagram accounts, and they are pushing wonderful resources and education out to their audiences. And so many of them, an Instagram account you can follow pretty much for free,
Right.
if it's a public account. And so many of them are putting out some wonderful tools right now for coping with anxiety during the coronavirus outbreak and the pandemic, and tools for just remaining mindful and, strong-minded during this, being able to work together as a team with your providers, and how to advocate for yourself and how to give yourself permission to ask difficult questions, even if you're scared about the answer that you're going to get.
Right.
So yeah, there's a lot there right now.
Those are good. Really, really good points, because there is a fear surrounding giving birth and having to face that monumentous time in your life alone. That's definitely not what they were expecting when they first found out that they were going to have this baby. So we're going to touch back on resources, but what I kind of want to do now is talk about postpartum. What happens now?
Period. Well, there has been a lot of research written about the first 40 days after a woman gives birth, and how well or how poorly that goes, and how that translates into the next 40 years of emotional well-being for both mom and her children. And so there's a lot of focus in the birth community, as well as a lot of focus with mothers who are becoming pregnant right now, just to learn as much as they can about how to navigate the postpartum process, or the first 40 days, as well as the first year postpartum, in as healthful and as well as a way possible. And certainly that looks a lot different than many people's plans. So for example, I had a mom who was pregnant, and I had been working with her for her entire pregnancy, and she was getting ready to birth about 3 weeks ago. And we had been working on a postpartum plan that included a meal train, people bringing her food from their homes and coming in to support her husband, who was also caring for their 3 other children. And the 3 children just happened to be all under the age of 5. So she's got a house full and a handful, and so did her husband. And so, they had hired a nanny specifically for this purpose. Nanny could no longer come. People who were planning to bring meals were worried that they might somehow infect them if they were bringing it from, homemade meals from their homes. And then even her mom was not able to be there for the birth, and that was part of her birth plan. And so she really was in a very difficult position, where a lot of people would experience, just being met with that much loss causes a grief response. It does. It causes a grief reaction, and it can cause us to be, very depressed. It can cause us to be even more fearful than we already were, because in the midst of a pandemic and, fears, natural, normal fears about giving birth, now I have to do it without my team, my support team, my support plan. I had it all lined up for the first 40 days, and now none of those people can come be with me, bring meals, help out by cleaning the home, by taking care of my older children, by giving my husband a break. we can't even take the kids to the parks or the museum or the zoo or, all of the memberships that we bought in anticipation for this time when I'm going to be home resting and recuperating with baby, and my husband's going to need some place to get out of the house and take the kids to. So you can imagine, having to pivot that quickly. And fortunately for her, because we had been working for such a long time on, just a mindful approach, being able to observe thoughts, observe feelings without judgment and without any kind of, fear-based response, but with a very, not necessarily detached, but more of a response than a reaction. She and her husband and the nanny and her mom and her birth team were able to put together a new plan of what it could look like and what they could do. And so, they had to tweak some things and, move some things around. And there's a great post on the birth center's Instagram and Facebook account that shows right after birth, her husband holding the baby up to the big windows in the birth center, and her older kids outside the window with her mom looking in at their new baby sister. So it was precious the way that they did it. It was certainly different than her vision and than what she had in mind. And I think that's really what I want to put my finger on, is acknowledging that this will be different and that it's okay, that it's not going to break you, that it's not going to ruin the 40 days, that it's not going to ruin the next 40 years, that, women have birthed in difficult situations, during war, during famine, without partners. We've had women who have labored, at home, and labor came on so fast that they ended up giving birth in their bathtub at home. That certainly wasn't their birth plan. It didn't happen during a pandemic, but it certainly wasn't their birth plan. And so I've helped women navigate what happens and how we feel and how we emotionally and psychologically adjust when life doesn't go according to the mental vision that we have in our mind. So it's kind of like I use the metaphor of showing up at the movie theater and you thought you were going to see Harry Potter, and what you really ended up seeing is Saw 3. How do you cope with that? What do you do when the movie is totally different and takes twists and turns you didn't sign up for?
Okay. So that's a really good takeaway from all of this. And I think it's an empowering message. Women are strong. They are very
incredibly strong. Incredibly strong. Oh my goodness. We have seen, I love working at the birth center as a doctor of behavioral health, because I feel like I get to see women in their true warrior strength capacity. The kinds of things that women can survive are truly incredible. And it's not just birth, it's, we see women who are in domestic violence, situations where they might have to leave a partner, that they've been married to or partnered with for a very long time, and, find themselves pregnant and sometimes with other children and having to leave home and start over, or hide for a while, or find the finances to somehow do it all alone. We also have, moms who can handle excruciating physical pain and somehow care for children with very special needs, or, be there, be present, both emotionally and physiologically and in person with babies who are born very premature, or who have, heart conditions or other conditions that end up with, a long extended stay in the NICU. The NICU is not a very fun place to be for parents. It's definitely, again, it's not that vision of, having that baby and bringing that baby home, skin to skin, and the golden hour, and, some of these things that women have read in books and online that are so important. So I think that one of the ideas that I've taken from a couple of experts in the field, Ida May is a midwife who wrote a wonderful book on midwifery that many people reference. And she recently wrote an updated edition that said, look, all of this is really good, but it's not to say that if you don't have any of this, that you can't have a strong, healthy
Right.
attachment and bond with your child. That it doesn't mean that your relationship is broken. It doesn't mean that you did anything wrong. It
No.
doesn't mean that you are to blame or that you are at fault. It just means that things are a little different than what it says in the book, but it means that you can make the best of it in any way that you know how to do. So, showing up for yourself and then showing up for your child, your children, your partner, your family, and, just trying to keep that strong-mindedness going, telling yourself, I am strong. I can do this. My body's going to do its thing, but my mind's got to do its thing too.
Right, right. These are all excellent points. Like I said, excellent points to bring up. And I know that you're going to be giving us some resources that we can take a look at.
Mm-hmm.
It'll be included with this as well. So I want to thank you for coming on here and chatting with me a little bit about this. It sounds like moms and moms to be, COVID-19 birth does not equate to failure, and
Right.
it doesn't equate to any loss of bonding
Right.
with the child.
Absolutely. I think you really hit the nail on the head there. I think it's all about the mindset that we take into this. And, remaining strong in the face of a pandemic is certainly a very tall order for moms and for their partners and families, but we got this. Your birth team is there. You've got supportive people. There are postpartum support international resources all across the world, and certainly in every state in the United States that are, wonderful, wonderful resources. Birth educators, doulas, lactation specialists, all are offering telehealth services. So none of that stops during a pandemic. We are all still here. Right. And so, not wanting to come in person for a meeting should not be the thing that stops a mother or, a birthing person from getting access to the resources that they need. So I just want to encourage everybody to, seek out those resources that are available online, or, through websites, just to make sure that you are actively and proactively advocating for yourself and your needs.
So resources are there. They may look a little different than they do on a normal day, but they're there.
Absolutely will. Yeah. And I think if we say it out loud, things will look different, right? If we say that out loud, right, it involves a little bit of acceptance, and, it allows us to say, okay, so if things are going to look different, what control do I have over how differently they look? What can we do instead of focusing on what I can't have or what I can't get anymore?
Right.
Yeah.
Okay. I love where this is going. I absolutely love it. I hope that new moms and moms to be can get a lot out of this and everything that you said. That mind shift to what can I do, and not just saying, oh, I can't do that and leaving it there, picking it up and empowering yourself with what can I do. Absolutely. Yes. Yes. That is a super strong message that I would love for everyone to hear. Okay. We can. That's right. That's right. We can. So, yes. All right. Well, thank you for being with us, and we hope to see you back again soon. Thanks for inviting me. I appreciate it. All right. Take care. All right. You too.